I remember very clearly meeting with a social worker at that facility at the time, and I knew nothing about social work. I was a 19-year-old, and I remember feeling as though we were not being heard as a family or being listened to, and just kind of glazed over. And that is exactly the moment I meant to become a social worker and changed my major from education to social work. You can't say enough about them being exposed immediately to what the community needs are. And where older adults are certainly not the only community need, they're a very important part of who we are as a community. And so getting the medical students out there first and foremost, I think is going to really have a lot of long-term benefit to their profession, to their impact on their profession, and to the community they serve eventually.
Sarah is, for me, I would say that the first thing that comes to mind is family. Not just her personal family. She definitely is a mother and a wife and a sister and a granddaughter, but she really looks at everybody as her family.
We're all individuals, and I will never forget that, and I hope the people that I work with never forget that, because when we quit treating the individual, we've quit treating the problem.
If she thinks there's a need or a concern out there, she's going to voice it. She's that person at the front of the room that will not let a worry or a concern die unless it's been addressed.
The most rewarding aspect of my job is not so much a sense of completion, but a sense of having again made an impact somewhere, be it small or large, in a group setting. I very much feel that approach to working with populations like older adults or populations at risk in general need advocacy, need community efforts, need people working together.
She has a vibrant personality, she's got a lot of energy, and she's well suited to work with volunteers and students and interns in our agency.
I think what drives Sarah the most is she wants people to be happy.
What motivates me daily in the work world? It's very easy, people. And I know it's a very generic, blanketed statement, but having an impact on lives, having an impact on your own life and doing the work that you do, it speaks for itself. I always say going to work at the Council on Aging is like going to church, because you're doing something that makes a direct impact on the community.
Well, I think she just has an aura of her being a positive attitude, and I think she gets them excited about what we do here. She loves her job, and I think it rubs off on the energy that she has on working with people, and gets them really excited and engaged in what they're doing.
The first thing that you need to do is understand the context of the community you serve. Where are you? Who are you serving? What is the majority of people you are serving? What is the majority of their needs? What are their barriers to education and health care and equitable access to goods and services? And in that way, when they're sitting on your patient table, or they're under your knife literally in the surgical room, or when you're writing their prescription, you make him see them as more of an individual, because you understand the context of the community you serve. Just like we're all individuals, no one community looks the same. I want to be remembered as somebody who had a damn good time. That's it. Somebody who had a damn good time and who had a good heart doing it.